And we interrupt your regularly scheduled program right now. Governor Ned Lamont is giving an update on the coronavirus outbreak in the state. He's in Hartford. Let's listen in.
And that's a trend line we expected and are ready for. And it's probably going to continue for the near term. I look overseas and I see that places like Italy had 400 COVID-related deaths today, the most ever. But I also know that other countries like Singapore and Hong Kong did early social distancing, made an enormous difference with much less infection rate and much lower death rate. And Connecticut's been early, and that's what we're thinking about, and that's what I wanted to talk to you about today a little bit. We've been working very closely with our mayors and first selectmen who have been extraordinary. We told them how risky it was for big groups and gatherings. We set a cap of 250. I think that's too high. I think 150, lower. If you're over 60, if you're over 70, stay out of groups, stay out of crowds, stay home if you can. You're a group, I'm in that group that is most at risk, and social distancing is most important there. I'm here with Fran Rabinowitz and Miguel Cardona on behalf of education, our superintendents. The superintendents have been extraordinary in this state. And I put out a strong recommendation, a guidance, probably much more than a week ago. And I said, at this point, I think it's risky for our schools to stay open, and I think they should close. A vast majority of our schools, Fran estimated probably over 90%, have already closed or are going to be closed by Monday. I'm issuing an executive order here now that we're going to close all schools by the end of business Monday. So there will not be, public schools following in the lead of some of our other states like New Jersey, like Rhode Island. I think it's really important in terms of what we can do to mitigate the extension of these germs. And that's what you see sometimes coming out of our schools. We've been thinking about that, what an impact closing a school has on a community, on a family, and on the child. And Miguel in particular has been working really hard on that in terms of how we can continue the education going forward. He's working with some of the online education companies. We'll be in a position, I hope, in the very near future to announce that we're going to have a free online education module available to each and every one of our students. We're working as well with our ISP, our internet service providers, to make sure that nobody's on the wrong side of the digital divide, and that all those kids have access to the online learning, and that we can have hotspots and Wi-Fi available for those places that need additional help. That may take a little bit longer, but that's a priority so that nobody gets behind. And speaking of telecommunications, as you know, we're also putting in place telehealth. We're making sure that's covered under Medicaid, under all of our insurance policies. It's so important to keep our healthcare providers, as well as each and every one of you, our healthcare providers safe, so they can be there to take care of each and every one of you. And that's why telehealth is going to be an important part of what we have going forward. Talk to your insurance providers, talk to your healthcare providers, make sure that we can give you the diagnosis you need, and make sure we can get you the testing you need. You know, right now, we're expanding our testing in a dramatic way, but that's still with a doctor's order, and the telehealth will be one way to help accelerate that. So we got telelearning, we got telehealth, and the other big change that's coming around is telecommuting. You know, tomorrow's the first day of a new work week, and I'm here with Josh Jabal. I'm also here with Andy Lamont, by the way, in case you're wondering, who gives me sustenance every day and focuses a lot on healthcare and gives me good advice. Josh has been taking the lead in terms of our state employees as we also continue to work with our business community. And when it comes to telecommuting, we're telling each and every one of our state employees, if it's at all possible, work with your manager, work with your commissioner. We'll try and find a way that you don't necessarily have to come to work, and you'll be able to telecommute and make it a little easier for you perhaps also to be able to take care of a child if they're at home. But we understand in private business as well as our state government, there are an awful lot of jobs where you got to be there. State governments, everything from our state employees to our healthcare workers, nurses, and we've got to make it easier for them to be able to get the work. So that's why Beth Bai is working hard to make sure we're able to extend daycare to those folks on a priority basis. In particular, our nurses and healthcare providers, so we can have daycare nearby so they can rest assured their kid is being well taken care of in a healthy and safe environment, and they'll be able to be there to take care of each and every one of you as we go forward. David Lamont is not here today, but he is working hard because we know what self-quarantining can mean, what it means if you're taking 14 days off, what it means if you're found potentially to be a carrier of COVID. And working hard with the federal government and working with our legislative leaders to make this easier. Make sure we can extend unemployment compensation to each and every one of those folks so they're getting compensated even though they're not able to work for, say, that 14-day period of self-quarantine. We're working very closely with Rosa DeLauro and the federal delegation in terms of making sure that paid medical leave is available for each and every one of our folks to make that easier as well. I don't want anybody to have any second thoughts. If you feel ill, you feel like you may not be right, you may have a flu, whatever that might be, we want you to stay at home. We want to make sure you have the incentives or no disincentives to make sure that you can stay at home. And that's why we're working hard in terms of making sure we have compensation and the paid health care going forward as you make those decisions. David's also been working very closely with all of our business leaders. And as well as working with all of our business leaders, we're working with all of our hospitals as well. Deirdre Gifford's been taking the lead on that. We've got to make sure that our hospitals are prepared for what could be coming. You see those pictures coming out of Italy right now with a number of people, mainly older people, who have to go into the intensive care unit. And we want to make sure that we're prepared for that. We have the beds for that. We have the nursing for that. We have the ventilators. We have the masks. We're starting our delivery of over 500,000 masks. Will be coming to the Connecticut from the federal government starting early next week. Taking the lead on that. As you know, we've expanded our testing in a dramatic way as well. I want to just say one other thing because I mentioned how important it is in terms of social distancing and what we've seen has worked so well in other countries. And we want to learn from that and do this on an early basis. And I think about, we're a small state. And you know my philosophy, it's much better if we work in conjunction with our fellow governors. So I've been in close contact with Andrew Cuomo in New York and Phil Murphy in New Jersey, thinking about other ways we work together. You know, one of them is we're going to be talking about what we do in terms of bars and restaurants. And it doesn't make any sense for Connecticut to do something and New York not, because then people just go across the border. So I'll be meeting with Andrew Cuomo as early as tomorrow. I just met with, just talked to Phil Murphy, and this is again a place where we're going to be working together. I'll be telling Governor Cuomo I think closing the schools are really important. He's going to be talking about what we do in bars and restaurants, and I think we're both right. We do that together. We know what's going on in Massachusetts as well. I just want to tell you that, look, it's a tough time, and I know how anxious people are, but I can give you just one story to make you feel a little better. It was Apple stores that were one of the first to close early on during the crisis in China, in Wuhan province in particular. And just last week, they reopened all their stores as China got on the backside of this pandemic and are working their way out, and people are getting back to work. And you probably know that Apple stores closed their stores in the United States just a few days ago. And again, we're going to get through this by working together, through making sure that we have all the social distancing we need. I know it's easy not to take this as seriously as you could, or a fear that perhaps we're overreacting, but I want you to err on the side of abundance of caution. That's why what we're doing with the schools. That's why we're thinking about in terms of other non-essential places that you may want to go and congregate. I want you to be safe. And in another month or so, I hope we're looking back and saying we've turned the corner. You know, with that, I'd just like to introduce Josh. I have Josh say a few more things about what we're doing for the business community.
Thank you, Governor. I'm Josh Jabal, Chief Operating Officer for the state of Connecticut. As Governor Lamont indicated, in addition to directing classes canceled in all public schools in the state effective Tuesday, there's a number of additional initiatives that we're announcing today, all in line with our continuing efforts, as you've seen every single day this week, to continue to take action to protect the health of the citizens of this state, to provide supports for the businesses of this state that are going to be struggling in the next weeks, and to look after the safety of our state employees. So a few additional announcements. In the executive order that the governor is issuing today, in addition to the part about closing classes in our schools, there are other elements of that executive order that include providing flexibility for municipal budget deadlines and other related municipal issues. As many municipalities are nearing their budget deadlines, the governor's order gives extensions and flexibility for hearings and other associated issues, which is important to help resolve issues regarding statutory deadlines and other notice requirements. We're also authorizing the Commissioner of the Department of Motor Vehicles to close branches to the public. This is an important step to limit interaction and promote social distancing. We will have DMV employees continuing to work, providing essential services, but as we move forward, those field offices will close. We're also aligning guidance around we had previously issued around nursing homes, really strictly limiting entry for guests to control and protect that population. We're extending that now also to some of our psychiatric facilities. So this will help relevant state agencies restrict entrance to those facilities to protect the vulnerable residents, patients, and staff who work there. Importantly, Governor Lamont today also filed a disaster declaration to the U.S. Small Business Association. This asks that federal agency to issue a declaration that will enable Connecticut small business owners to receive economic injury disaster loans. If that's approved, and we expect that to be approved very swiftly here, the economic assistance will enable the owners of businesses and also nonprofits to get some relief during this difficult time, and they'll be able to access low-interest loans up to $2 million directly from the SBA, and our Department of Economic and Community Development will answer questions and provide assistance once we have that approval. Our Department of Revenue Services is extending certain deadlines. There are several deadlines tomorrow, in fact, for the pass-through entity tax and the corporation business return. Those deadlines are being extended, and the payment dates for those are being extended as well to provide some relief for businesses who may not have had the chance to get to those given some of the severe challenges that they've been dealing with lately, and to provide some extra cash flow so that they don't have to make those payments right away and we can collect those at a future point in time. Yesterday in the executive order, Governor Lamont, among other things, modified certain laws that permit pharmacies to sell and compound their own hand sanitizer. We know there's a global shortage of hand sanitizer out there right now, and so today we're following up on that executive order with an implementation order from our Department of Consumer Protection that outlines the rules that pharmacies need to follow so that they can begin actually compounding their own hand sanitizer here in Connecticut, which will be very helpful. And finally, we want to remind anyone that if they lose employment, our Access Health CT will be open for them to apply and add healthcare insurance. If they have questions, they should go on the Health Access CT website, and there are a number of additional healthcare resources there for people who need it. With that, I think we'll take your questions.
Governor, the governors of Illinois and Ohio have already gone forward and with a restaurant and bar ban. When you talk to Governors Cuomo and Murphy tomorrow, is this something that you would recommend doing?
I want to do something in conjunction with them, and I think it makes a lot of sense. I think, look, we're saying non-essential travel is risky. I think a lot of venues where people congregate is risky as well. Hopefully it doesn't go on for long, but it makes some sense to me.
Do you know what that would look like?
I can tell you in other states, some have a curfew at 8 o'clock or 9 o'clock. Some are actually saying no. But I'll tell you one thing, I care desperately about these restaurants, and I want to do everything I can to help them. I think at a minimum, we ought to go support our restaurants as a takeout entity. Do what you can, or maybe get a gift certificate. Maybe you don't want to go there this month, but help them keep going. I care deeply about small businesses, but so those are some of the ways I'm thinking about this.
So, Governor, what does the state of Connecticut look like I mean, there's no quarantine, right? There's no quarantine mandate. You're not telling people they have to stay.
There's no quarantine mandate, but my strong recommendation is stay out of groups, certainly stay out of big groups. If you're over 60, over 70, stay close to home. If you love grandpa, don't go visit them because they're just much more subject to a risk. Teach them how to FaceTime. I think in terms of schools and the such, kids are going to be staying closer to home. We're trying to do everything we can so they can continue their learning and stay close to home.
How long will schools be closed for?
Right now we're saying through March 31st, which is 2 weeks. I have no idea whether it'll be 2 weeks, but plan on 2 weeks for now. We're going to have to take a second look in about 10 days.
And does the distance learning include pre-K to 12, or is it just K to 12?
You want to talk about that, Miguel?
Sure. Thank you. Thank you, Governor. So our efforts at the agency now are shifting from providing resources for supplemental learning to really thinking about what does long-term distance learning look like and how can we best support districts to make sure that all kids in Connecticut have access. You know, some districts now have tremendous programs for distance learning. Other districts don't. So we really want to work hard to fill that gap. And as the governor mentioned, we're working on some plans to try to make it accessible to all students in Connecticut. The opportunities for students will be early childhood. If we can get pre-K in there, that's critically important as well. But we've yet to determine the specifics. But I do know that we have a lot of superintendents that have great plans that are looking to share now and working with CAPS. We're going to make sure that education doesn't stop because of this. It's just going to look different. And my guess is the way it looks moving forward is probably going to influence how education is going to be forever. So we're prepared to make that shift.
And how big are the early child care centers that you're having to set up because of the situation? How big are those? How many kids, can be in one, and how does a parent access that?
So the details on that we're working on now. The agency is working collaboratively with other agencies to not only look at childcare, but also how do we feed students. So I'm proud to say that Stanford fed 500 students Friday. And I'm proud to say that I've seen multiple letters on Twitter and on Facebook from districts to families saying how their children can come pick up breakfast and lunch tomorrow. So they've been working really hard over the weekend to make sure that students have those basic needs met.
What about magnet students?
Yes, so we're working on getting approval for those districts to also provide. We had 74 applications between yesterday and today, and 74 of them were processed and approved, and we expect to have a quick turnaround for those districts that apply in the coming days.
There's a report that the Hartford man who tested positive attended a religious event last week, potentially with hundreds of people. Governor, I wonder, does that make you rethink the religious exemption for large gatherings? Is that a step you'd take at this point?
Oh my God, I'd stay out of all large groups. 250 was just a number just to get the conversation started. I think your point is well taken. I think the smaller the group, the better. Stay back, social distancing. It's just common sense today.
What about specifically with religious groups? Do you think it should be applied to them too?
I think it probably should. I'm talking to a lot of the religious leaders. Obviously, I'm encouraging folks to stay at home if you can. Worship at home yourself, especially if you're over a certain age. It's a risky behavior to go right now.
And what about, can I ask about the Department of Labor? Are they equipped to handle the number of unemployment claims that I'm sure will start coming in on Monday?
Yeah, why don't you take that, Jeff?
Yeah, Commissioner Westby is on that. We anticipate, and Secretary McCaw, we've been working closely together to authorize additional overtime as necessary to ensure that the staff is prepared to handle the claims, which we've already seen to start to tick up. So we'll be prepared.
A lot of people probably were shocked this weekend seeing the grocery stores and all the bare shelves. Have you talked to any of the markets in terms of restocking, how quickly that might happen, and any advice to people in terms of how soon they can expect things to be back?
I don't know how soon you can expect things to be back, but, buy what you need. We're a family here in Connecticut, and what you take extra is something that somebody else won't be able to get. So I tell you to please be careful about that. And again, I'd support our local stores. I'd support our local restaurants, like I said. And with that, Christine looks like she's about to freeze, so I think we'll call it a night. Thanks, everybody.
How many cases do we have confirmed in our state as of right now?
26, I understand.
26 cases. Do we know how many people have been tested?
We can get the aggregate number to you.
Okay.
What's changed since last week with closing the schools? Why close them now?
I think we see the urgency of the situation. I think we know that there is some community transmission out there. I think we know that, we're all parents, or a lot of us are parents. We know that kids can transmit germs. I think it's a prudent thing to do. Thanks, everybody.
Thank you.
Appreciate you coming.